Okay, so today we are going to talk about how to support a woman during the loss of a pregnancy or the infant after delivery. Okay. Okay, so the first thing that we need to realize is that a perinatal loss is the loss of a pregnancy anytime during the pregnancy. It can be sudden, it can be due to many different circumstances. It can be the death of her infant after birth. It can be immediately after birth, or it could be several days or months if it's a premature delivery, depending on how premature that infant is. I think what we have to realize is that a woman starts to create that attachment and bonding differently with each pregnancy. Some women will start to bond and attach to that pregnancy the moment that they realize they are pregnant. Some women, it's maybe not until they actually feel the infant moving in utero and it becomes a little more real. And some women, it just depends. It's different for every woman. So I think what I'm trying to say is that don't treat a loss differently because it maybe is occurring in that first trimester early due to a spontaneous abortion or miscarriage than if it's occurring later due to a stillbirth or the premature infant dying after birth. There is still that attachment and that bonding that occurs. The other thing to keep in mind is you have probably studied the grieving process in one or few of your classes since you started. And what we have to realize is that loss and grief is a dynamic process that is changing. It evolves over time. It is a process. There is no specific process that every person is going to go through the same, okay? And it's not something that they're just going to work through in a few minutes, a few hours, a few days. Sometimes it takes months. Sometimes it even goes on for years, as we're going to talk about in a few minutes. And it's very individualized. People do not grieve the same. So we need to realize that individuals are going to grieve differently, okay? And we are there to support them. And that it can be pervasive, which means that it can infringe on all parts of their life, okay? It can overtake their life. That can be a temporary thing, and then they work through it, or it can become a long-term situation in which we would need to recognize and identify. So you've probably learned about the different stages of grief. We're going to talk about different responses to the grieving process that a woman might go through with a perinatal loss and grief. So the first stage or the response is going to be that period of acute distress. This is when the loss happens and they are faced with the situation that she has lost the pregnancy or she has delivered and her child has died. So this is the acceptance that this is really happening to me now. And you can see their initial reactions are shock, crying. They may start to show signs of depression. What's interesting during this acute distress response is that they may have to make some decisions. Depending on where that loss occurs, if it's a late loss or if it's an infant that was born and then died, they may have to provide information for a birth certificate if the infant was born alive. They may have to name their infant and provide that information. They are going to have to notify family members and friends of what has happened. They are going to maybe have to make funeral arrangements depending on the loss. So they're going to need to not only take in what is happening, but also make some pretty big decisions in that process. The next step is going to be intense grief. This is when they start to, probably usually after they go home, and they're going to have to adjust to the fact that they are leaving the hospital without their infant, or they are leaving after having a D&C because of a miscarriage, and leaving knowing that they are not pregnant anymore. This may have been a dream of theirs to become pregnant and have an infant, and now they have to adjust to this new circumstance that has changed, and that dream is no longer going to become a reality. They're going to experience all kinds of feelings, of symptoms, depending on how they react to their grief. Okay, you can see feeling empty, feeling lonely, even though they may have others around them, because they no longer have that child with them. Guilty, maybe do they feel like they did something that might have caused this? That's a common thought. What did I do for this to happen? Anger that it happened. Why did this happen? Why did it happen to me? Becoming sad. It may even cause physical symptoms. We know that depression can cause physical symptoms such as fatigue, headaches, physical aches, appetite disturbances, sleep disturbances. It also may get to the point where it's called a disorganization, and it interferes with their ability to complete their tasks of daily living. And usually this is a temporary situation, and then they work through it. Sometimes we have to recognize if this continues on, then we may have to acknowledge that, and they may need outside help. But sometimes they may actually have a temporary period of time where they may have difficulty going to work, taking care of things that need to be done at home. If they have other children, taking care of their other children may be difficult in that initial period. And then they're going to get to the reorganization phase, where they are starting to work through their feelings of grief. They are starting to get back to their daily life, being able to work through their daily activities without any difficulty. This is when they may be able to actually start asking, why did this really happen? And to tell you the truth, many times when a pregnancy is lost or miscarriages or terminates on its own, or the infant dies in utero, such as a stillbirth, many times we don't know why. We don't know the answers, okay? But they may start to kind of wonder, come to terms with it. If they are still in that relationship with that significant other, it may become easier where they can think about resuming a sexual relationship, becoming intimate again, because sometimes the thought of that is painful because of the thought that that's really where the pregnancy begins. And am I ready for that yet? They may start to think about having another child. They may feel like they are in a place now where they can try to become pregnant again. Bittersweet grief is when a person has had a perinatal loss and there are events later in their life that make them think about that loss. So maybe it's the anniversary of that loss. Maybe it's attending special events for others. Maybe they are at the wedding of a friend's child and they're thinking, oh my gosh, I will never get to experience that with my child that I lost, that pregnancy that I lost. Birthday parties can bring up those thoughts. Oh, my child would be 5 years old now. My child would be learning how to drive. My child would be graduating college. So they're just reminders of what could have been. All right, so how do we support someone who is going through this loss? And this is in that initial period when it is happening or has just happened. I know it can be very difficult thinking, I don't know what to say to them. I don't want to say the wrong thing, okay? I remember being a very young nurse and thinking, I have no life experience. I haven't experienced this. I don't know what to do, what to say. Then the simplest thing could just be me saying, I'm sorry, or I don't know how hard this must be for you. Or even if you're afraid to say anything, then just maybe sit down next to them, hold their hand, put your hand on their shoulder or just let them know that you are there for them, okay? And then we all know that there are things that we just never should say. They are not supportive. They do not provide any comfort. And I've heard people say this in the clinical setting to patients who are experiencing a loss or who have just experienced a loss. It's okay. God has a plan for you. You're young. You can have other children. Well, that may all be true, but how does that help support them in their grief right now? Okay, so those are the things that we shouldn't say. So just say something very simple as I'm sorry, or just provide some type of physical contact so that they know you're there for them. Let them know that however they are feeling is okay. All right, we know that everybody is going to grieve differently. We don't want to put our feelings upon them. Don't assume that you know how they should grieve, okay? Let them know that they are not alone, that you are here for them. Do they want you to call anybody to be here with them? Family members, a friend, maybe someone from their church, okay, to provide support. And then while they have to make some of these other decisions that we talked about, maybe funeral arrangements, depending on the loss, depending on the age of the fetus or infant at the time of loss, there may be the option of an autopsy, maybe not. Do they want to pursue that? The important thing is to make sure that someone else is not making those decisions for them. Whether it be yourself as the nurse or if there are family members with them, the decision really has to be theirs, the parents, because they are the ones that are going to live with those decisions, okay? Support groups. There are support groups out there for individuals with perinatal loss, so we can provide them with that information. Okay, sometimes it is very difficult for a woman to stay on the OB floor. If this is a late loss in the pregnancy and she needs to stay in the hospital, maybe it was an abruption like we talked about last week or beginning of this week, and the infant did not survive. But she's a postpartum patient. So it might be too difficult for her to be on the OB floor, to hear babies crying, to hear people talking about their babies. So it is their choice whether they want to stay on the OB floor or leave the OB floor, okay? If they stay on the OB floor, most units have some type of card that is placed on the door of that room, which designates that this is a loss. This mom has experienced a loss of her infant, And so everybody who works on that floor, for whatever reason, knows what this card means. And it just protects the woman's emotional state from someone walking in and saying something like, something about their baby, or, oh, is your baby in the nursery right now? How is it being a new mom? Okay, which would be very emotional and distressful for them. Okay, so they can leave the floor if that's too painful. We can always make changes. We can allow allowances to visiting times and the amount of visitors for them to have more support from their family and friends. Giving them resources for support groups if they want to try those. The other thing we need to remember is the other members of the family and to include them. Many times grandparents are very involved during this time. They will also be grieving not only for the loss of their grandchild, but it may be painful for them to see their own child experiencing this loss. Siblings, if they have other children in the family, may be brought to the hospital, might be involved. That really depends on the family and sometimes the age of the siblings, okay? But if the siblings are old enough and the parents feel like this would be beneficial for them to be part of this, then we can allow that depending on what's going on the unit. And then we typically will create something for the parents to take home with them for future reminders of their child. And so a memory kit is a very common thing that is used on the OB units for perinatal losses. And you can see the different things that it includes. It basically just includes things that are reminders of that child. Now, of course, depending on when the loss is, determines whether we are able to include a memory kit. Usually, if it's a miscarriage in the first trimester or early in the second trimester, we may not be able to create a memory kit like this because the fetus may not have been developed enough for these things to be done. So this is more for a loss later in the pregnancy. But these are things that we would use to maybe wrap the baby in, take a lock of hair, take a picture of the baby. There's usually a card that is signed by the staff members that took care of her, okay? And then we offer it to the mother and she can take it home. Most of the time they will accept it. Sometimes we will have a mom who just doesn't want it because she thinks that it's going to be too painful, a reminder. So if that's the situation, you can maybe offer it to a family member for them to keep. And that way, if she changes her mind, she still has it and they can give it to her. Other things that we're going to do to help family get through this loss is we unfortunately have to, this might sound harsh, but make this loss real. We need to use appropriate language to help them work through it. Many times we try to soften the severity of the situation by using the phrases, your infant is gone, your infant has moved on to a better place, or has passed away. We really should use appropriate medical terms such as your baby has died, you have experienced a miscarriage, okay, so that as clinical as this sounds, it's straightforward, okay? And it's going to be more difficult maybe for them to hear these words, but it helps them take in what has actually happened. The other thing that we do is we, depending on the loss, if the infant is developed, we will offer the family to see and hold the infant after death. And this is very individualized. Some women want to see and hold their baby after the death. Some do not. It's too painful. So it's very individualized. We can allow other family members to be with them during this time also. We want to present that baby, even though that baby is not living, we want to present that baby in the same manner. So we may bathe that baby first. We will dress that baby, or maybe it's just swaddle that baby in a blanket and put a hospital t-shirt and diaper on and put a hat on, okay? One thing to remember is if there is some sort of physical anomaly with that baby, is we want to make sure that we let the parents know that ahead of time as to what they might be seeing, okay? How long they keep their baby is very individualized. I have had families that only hold their baby and see their baby for a couple minutes to say goodbye. I have had families that will keep their baby for an hour, 2 hours, couple hours. I remember one family that would see their baby, hold their baby for a few minutes, maybe 20 minutes, and then turn the light on and say, okay, I'm done. And then we would keep the baby on the unit for a little while, and then they would put their light on, you know, can I see my baby again? And it was kind of a back and forth. And we had actually at some point thought that they were done and ready and taken the baby down to the morgue, and they wanted to see their baby again. So I went down to the morgue to get their baby so that they could see their baby again. So it is very individualized, okay? Other things to consider are cultural aspects. There are different maybe death rituals or practices in different cultures and religions, so be sensitive to that. If they're asking about different things like that, then, and you're not sure about it, you don't understand that culture or that religion, don't be afraid to ask them. Have a conversation about that, okay, so that we can incorporate that into their laws. Many units will follow up with the woman after discharge with a phone call to see how they are doing. And then as the nurse, either the labor and delivery nurse or the nursery nurse, you would be the one that would prepare that infant and take that infant down to the morgue if it is a late pregnancy loss. Okay, other circumstances. I talked about how women usually will work through the process and then get to that reorganization stage where they get back to their daily living. There are some women who get stuck. Oh wait, not yet. Other losses that you may not think about, okay, are, remember we talked about prenatal testing. Maybe their pregnancy, there was a diagnosis where the infant, once it's born, he or she is born, sorry, is not going to live. It's incompatible with life, their medical condition. So they may have to decide, they may decide to terminate the pregnancy. That's a circumstantial of losses that you may not have considered. A woman who is pregnant with more than one infant, whether it be twins, triplets, quads, quints, however many there are, there's always the chance that maybe one of those infants will not survive. And so this becomes very unique and interesting because the woman now has to grieve the loss of a child and celebrate the life of one or more children. And that can be very difficult. So we're going to need to provide some support for her. An adolescent girl who has had a perinatal loss, who has lost her infant has died or she miscarried. She may never even have experienced a loss before. And so she may need some extra support. It may take her longer to work through that grief, okay? And then I added this a couple years ago, adoption. because one of my students came up to me after class and talked to me about it, and she said that when a mother gives her baby up for adoption, whatever the reasons are, that they may experience or go through the grieving process also, because they do carry that child during pregnancy, they give birth to that child, and then for whatever reason that they chose adoption, they now are giving that baby to someone else, and they are not losing that baby in death, but losing that baby. And so sometimes that may be a circumstance where they might go through some emotional turmoil. And so it's important to be supportive of them also. So now here we go, where I started talking about how a woman can sometimes get stuck in her grief in that phase where they can't get through the daily activities. They can't work through their grief on their own. Sometimes it can lead to alcohol and substance abuse. Okay, it can be that detrimental and that pervasive in their life. Okay, and so it's important that there's someone that's able to recognize that. Maybe someone who sees her for her follow-up visits or her family members. Risk factors would be somebody who does not have a good support system, or maybe has a history of mental health illness. Okay, any parent, it doesn't have to be just the woman, it could be the significant other who gets stuck in the grief. You have to remember that it's not just the mother who's going to grieve, okay? It's going to be that significant other also. So either parents who we notice are experiencing what we call complicated bereavement because they are unable to work through the grieving process, need to be referred to counseling. They are going to need professional health assistance to work through their grief now at this point. And so it is very important that it is recognized and that we refer them to the appropriate resources, such as a healthcare provider. Okay? That's the end of the lecture. I have posted a video on Blackboard called Nurses Grieve Too, and it is it's from nurses who work in obstetrics, and they talk about helping women during their time of loss and maybe how it affects them and how they get through it. And even though it is focused in OB and perinatal loss, I think even if you're going to go work in a different area, it would be very, very beneficial to watch the video, because helping patients with death, no matter what kind of death, or the family members, helping family members can be difficult. And the impact it has on you, because you are a human being, you have to figure out how to maneuver through that. And so I think the video would be helpful for all of you. Okay, that's it.